So, welcome to the presentation, Acupuncture for the Knee. So let's begin by looking at an intro and going over some key points that I want to present. And I'm going to give you a lot of new information tonight at whatever level you're at, whether you're a beginner or you're at a more advanced level. The way that I integrate information with traditional methods and the balance method and Tong's points, and the way that I mix that with myofascial lines is very useful clinically. It has a lot of applications. And one of the key things that we're going to be doing then is learning distal points for knee pain and disorders. And why we want to start at distal points is because it then allows us to continue our assessments, to provide acupressure or other manual therapies, and to provide movement therapies on the affected region, and in this case, the knee. So one thing that we'll be doing is comparing distal points to local points and talking about how to use some of the distal points and how to use local points and when we want to use distal points and how to use the local points should we need to. A lot of times I don't even need to use them. The next point here reads, we're going to relate various points to the myofascial lines to develop an understanding of biodynamics. Now, let me show you some of the myofascial lines that we're going to be looking at here tonight. So these are the arm lines, and I've organized these according to various myofascial arm lines and have listed the points that are used for treating the knee. So here we see the superficial back arm line, and then we've got various points like Lingu and Li11 is a great combination, one of the primary ones that I use, and it's on the superficial back arm line, these points are, and these other points are as well. Now, we'll get into the details of this, but I just want to give you a quick overview of how this is presented. Now, I'm going to do much more than just go over these points because for some of you, and maybe even a lot of you, you're already familiar with these. So what we're going to spend a lot of time on is discussing the biomechanical factors that are related to various types of knee pain and disorder conditions. So when you understand the biomechanics behind this and how to pair the points and then work with movement and work with local manual therapies and acupressure, you'll see much better results than just using needles alone. And this is one of the key points of doing distal needling is that you need to make sure that you're having the client move the affected area and that you're either having them move or providing local hands-on treatment in the form of acupressure or doing some sort of assisted movement. Okay, so we're going to look at that, and we're going to spend a lot of time on that in terms of how to provide local hands-on work, how to teach the clients how to move their joints, what movements to have them do for the knee so that they can get the best benefits. Let me go back here. Another thing that we'll be doing is reviewing some common structural imbalances that relate to knee pain and disorders. We're going to learn how muscle dynamics like chronic contraction and chronic lengthening in the muscles relate to postural and structural issues of the knee. Okay, so this is very much a biomechanical approach too, that's mixed with Master Tong's points and even some of the TCM principles. And the next point here is we want to learn a system of treatment, okay? So when you have a solid system, then that allows you to get better results as well. So we're going to start with the distal points and what distal point we can use. And then we're going to go into movement and local manual therapy. So once we do the distal point, we're either going to want to have the patient move the affected area or provide local manual therapies like acupressure and assisted movement. Now, after that, we can needle the affected meridian as well. So if they have pain in the stomach meridian in the knee, like let's say it's located around stomach 35, we can needle a point like stomach 36 or stomach 34, or maybe both of those. And those are the TCM principles that we're already very familiar with. So I'm not going to spend a lot of time on that, but we can needle that affected meridian. And that's what we refer to as a system 6 method in the balance method, where when we needle the symptomatic meridian or the affected meridian, then we can also refer to that as system 6. Okay. And then the other thing that we will be discussing in part of this system are the channel points. So when you needle the affected meridian or channel, we can needle channel points that are distant from the affected area, or we can needle locally directly into the affected area. Okay, so I want to distinguish between those because there's a lot of advantages to needling not directly into the painful area, but in areas that are on that same meridian or on that same myofascial line, but are maybe 2 sun or 3 sun or 6 sun away from the painful area. Okay, so I'm going to present this system and how I go about doing that. And one of the advantages of not needling into the local area, but distant from it, but on the same channel, is that we're able to reach some of those trigger points or those chronic contractions in the muscles, like in the hamstrings, that are involved in the condition. And that can help to get us a better result than just needling right into the painful area. Okay, so this is allowing us to get to the root imbalance rather than just treat the symptom. All right, so this is pretty much what I was already speaking about, so we're going to skip over this. Now, let's get into some of the points because that's always a big question and a thing that a lot of people want to know just straight away. Just give me the points. So here's the points, some of the key ones that we're going to speak about on the arms and on the superficial back arm line include Lingu and Li11. And then 22.06 and 22.07 is on the Sanjiao line. So 22.06 is essentially Sanjiao 3. And then if we go to the proximal junction of the fourth and fifth metacarpals, there's 22.07. These points are frequently needled as a pair, as a Daoma, and you can use these for treating the knee. These are used in the Tong system for treating knee pain. We can use Zhenjiang in the center of this shoulder as well as Sancha. Okay. So I'm going to spend just a little bit of time on this, but one thing I don't want to do is I don't want to spend a lot of time on stuff that you are already familiar with or that you can access through books or websites that you're already familiar with. But I just want to quickly go through these so that we can have some perspective on what points we'll be using as we begin, because these are the distal points that we want to start with a lot of times, or at least these are the primary ones. On the front arm lines, we have 22.01 and 22.02, which if you're not familiar with those, we can see those right here. These are in the palm. And one of these points is opposite of Lingu, which you should all be familiar with. And then we've got 22.01 here. So we've got these 2 points in the thenar muscles. We also have another group of points called 22.11 or Tu Shui. We can use this set of 3 points for treating knee pain. These are traditionally used in the Tong system for knee pain and especially medial knee pain because of the connection between the lung meridian and the spleen meridian. And the lung meridian connects to the liver meridian as well. So these are points that we can use. And let's go back up to this slide here where we see some of the front arm points. We spoke about 22.01 and 2 and 22.11. Now, Dr. Tan in the balance method would teach that you can use Long 5 and PC3 as well. He would teach that you could use PC3 and PC6 as a combination, because we should remember that in distal needling and in the T&T systems, which refer to the Tan and Tong systems, the balance method and Master Tong's points, we use these distal points and we do something called imaging and mirroring. So if we want to treat the knee, we can use points in the elbow, like Li11, Lung 5, PC3, and this can be tremendously effective when we use mirroring and use points in the elbow to treat the knee. Another point that we find near the elbow that's used for knee pain in the Tong system is 33.12, which is 1.5 sun below the olecranon, and it's used to treat posterior knee pain, but you can also use it for pain in other regions as well, because the small intestine meridian connects to the liver meridian, and then it connects to the bladder meridian through the Tai-Yang relationship. So if it's medial or posterior or medial posterior pain, you can look at using this point, and you can also use that point for knee conditions that are related to the bones, because we can provide bone pecking at that point quite easily. Now, here's some leg line points for knee pain, in a TCM approach or a more standard approach like we learned in school. You might use points that are on the affected meridian. So if someone has knee pain in stomach 35, you may use stomach 36 or stomach 37. And that's one method of needling those points that are on the affected meridian. And then over here, we see the lateral line, which looks a lot like the gallbladder meridian. And there's a group of points that we can use in the IT band or the tensor fascia lata that we can use to treat knee pain, because the IT band, it transverses across the knee joint. And this is actually a very common area where people will have problems and imbalances that relate to the knee pain. And we're going to be speaking about this pattern a lot tonight and how we'd use these points and when we want to use these points, okay? And let's see, what else do we have here? We have the deep front line points. So over here, we can see the deep front line. And the deep front line includes the leg yin meridians, what we think of as the liver, the spleen, and the kidney meridians. And Dr. Tan would teach that liver 3 and PC6 used together is a good combination for knee pain. I like that one as well. And the method is to use PC6 on the opposite side from the knee pain, and then to use liver 3 on the same side. One thing that you should know about these deep frontline points, like liver 3, is that they get into the deep areas of the knee, the deep fascial connections, the deep ligament connections, and the deep part of the knee capsule. Okay, so I do like to use those points when people complain of like a deep pain, or they feel it through their entire knee, or they're not really sure where it's located because so much of their knee is painful, and they're not able to locate it because the pain is so widespread. So for patterns like that, think of using deep front line points on the same side. Unless they've recently had surgery, you don't want to needle the same side immediately after a surgery. Other points that we can use on the deep front line include spleen 6, spleen 9, Shen Guan. All of those are going to get to those deeper levels if you get your needle angle right. So you need to make sure that you needle deep enough and angle your needle towards the tibialis posterior muscle. Because if you angle your needle in such a way that it goes into the gastrocnemius or into the soleus muscle, you're going to get the superficial back line, and you're not going to get that effect that you will if you reach that deeper muscle, being the tibialis posterior, which is a part of this deep front line. Okay, now you can reach it through liver 3 and spleen 6, but when we get to kidney 7 is really interesting because a lot of you are not going to be reaching the tibialis posterior, and it can be difficult to reach the deep front line with kidney 7. And there's a very good chance that you're only going to be reaching the superficial back line because of the soleus muscle and the anatomy of this. So this is one advantage of understanding the myofascial anatomy, is it really allows us a anatomical perspective and a really solid perspective on how these points work and why sometimes they work so great and why other times we don't get the results. So when you understand that by needling kidney 7 that you may not be reaching that deep front line and you're only getting the superficial back line, it can have tremendous insight and help us a lot, okay? The other thing that I want to mention here on the leg line is here we see the superficial back line, and the superficial back line looks a lot like the bladder meridian. Now, when we're treating knee pain, and this is something that I'm going to cover tonight, For a lot of clients, if they feel pain in the back of the knee, or if they have internal or external rotations, which we'll be discussing here shortly, you're going to want to check to see if you find trigger points or ashi points in the hamstrings, in biceps femoris, or in semitendinosus and semimembranosus. Because if these muscles in the hamstrings, or if biceps femoris is in chronic contraction, that can cause a external rotation or be related to an external rotation, and that can be putting strain on like the MCL. Okay. So if the leg is in external rotation and it's straining the MCL, then you may find that you get really good results by releasing the trigger points in biceps femoris. And it may be those points that give you that extra 40% improvement, or that unlock the pattern that's present, and the root pattern. Okay. Now we're going to get more into that, into the biomechanics of this, but let's keep cruising along. Now, part of what you get in this course is you get access to recorded videos that I've already made. So I don't want to spend a lot of time on some of the stuff that's already in the course material, okay? There's videos that are there waiting for you to watch that discuss the tongue points in greater detail. I've done recordings of this slide and the superficial back arm line points,